So we really need to work as a society. We need to work together to try and prevent this.
10 months ago, the coronavirus disrupted our everyday lives, crippling the economy while experts scrambled to learn more about the deadly virus. And now, nearly a year into the pandemic, the CDC says a new strain of coronavirus, a more contagious one first seen in the UK, could already be in much of the United States. Also known as the B.1.1.7 variant, so far in the U.S., infections have remained isolated except for an outbreak in California. Though Dr. Christopher Thompson with Loyola University, Maryland, says there's no evidence showing the new strain is deadlier.
It's hard for us to say at this early stage that it's more deadly or less deadly. The thing is, we know that it looks like it's more transmissible. And so the more people who get it, the more likely there are to be a higher number of deaths potentially.
And while 2 COVID vaccines continue to roll out across the nation, their effectiveness against the new strain and a newer one is in question.
The mutation that occurred, we are hopeful won't be one that will impact the virus, but we're not sure. There is a second strain, a new strain that has popped up recently too in South Africa, and the mutation in that one is a bit more concerning. So we'll need to keep a close eye on that too, but that is very new information, and we don't have any data to be able to make any assessments about the antibody protection or the vaccine. The mutation is probably not going to affect the part that we've targeted the vaccine against, or we're pretty hopeful because we've targeted a really key part of the virus.
And while it's yet to be seen if the vaccines can protect against the newer strains, Dr. Thompson says it's still best to get a vaccination. He says if 70% of America gets the vaccination, we could get back to a relative normal by late fall. On the campus of Loyola University, Maryland, I'm Trey Ward, WBAL TV 11 News.